And this morning, we are joined by Dr. Siti Nadia Tarmizi, friend of the network and also the head of Indonesia's Health Ministry's Communication and Public Service Department to discuss more on this Mpox situation. Good morning, Ibu Siti. Thank you for being with us this morning.
Yeah, good morning, Paul, Shafira.
Always glad to have you, but unfortunately it's under these more dire circumstances. So we did mention that the World Health Organization has declared a state of emergency for Mpox. Now, can you provide us an update on the current global situation as well as the situation here in Indonesia?
Yeah, I think we know that the Mpox, what we know as the monkeypox, it was discovered around 1988. And the first case reported from the Republic of the Congo in 1960. And then we know it's again, there is like across globally, there is eradication for smallpox. So we don't have any case Mpox reported after that. But in 2003, there is like an outbreak again regarding Mpox. And I think the number is casing during May 2022. In Indonesia itself, we found the first cases of Mpox in 2022. Same when the WHO announced Mpox as the public health emergency international concern, or we call it as the global concern. And in 2023, we have like 73 cases. But in July 2023, WHO announced that they don't concern Mpox as one of the global concern anymore. But later, in 14 August 2024, since there is a high number of cases in Africa, especially in Congo, and it is affected to the children, again, WHO raised the concern at the global level, stated as the Mpox as the global international concern again. In Indonesia itself, we know in 2022 we found first cases. It was imported cases. In 23 we have like 73 cases, and in 2024 we have like currently 14 confirmed cases, and then we still have like 5 suspect cases under laboratory examination.
Now, even though the numbers are still just in double digits, is there a chance that this could become some sort of pandemic? I know we just got over the COVID-19 virus. Could this become something like a pandemic as we've seen before?
If we've seen the number globally, the number is since 2022, it's just like 103,000 cases, and with the around 225 death cases. So if we see compared to the COVID-19, the spreading is very low in terms of the Mpox. But still, we need to keep our awareness, because this is the contagious disease. It can be spread across everybody, and we found in the Congo there is like new clades or new variants that we found the case fatality rate is higher. It's like around 5 to 10% compared to the first clade that, or the first variants that we found is only less than 1%.
Okay, so since you mentioned there are there are 2 clade, clade 1 and clade 2, what set them apart from each other, Bu Siti? And which clade presents the highest risk, especially for children and also seniors?
Yeah, when WHO first announced the global concern, it was clade 2, or especially they have like 2 subclade, 2A and 2B. And mostly in Indonesia, we found that the case is come from the subclade 2B. And we know this subclade 2B or clade 2 is less severe, so it's very mild. And then the rash, you know, the Mpox have rash, yeah. It's very a small area, and then the case fatality rate is less than 1%. That's why WHO increase again the stadium of the Mpox disease as the global concern, because the clade 1, or we know as the subclade 1b, we found there is a severe disease, more lesion, more rash, and it already affect to the children, and the number of the death case is increasing around 5 to 10%. So that's why again WHO have a concern on this Mpox again in 2024.
Okay, Bu Siti, we've seen that airports like Singapore's Changi, Bangkok's Suvarnabhumi, and even here in Bali, Ngurah Rai, they started screening for Mpox. We know that in regards to COVID-19, one of the reasons it spread so fast is due to people being so mobile, going from country to country. So is something like this enough as a preventive measures, and what additional measures can we take?
Yeah, of course, if we notice, the Mpox in Indonesia itself is not imported cases. So it's already, the virus is here. But what we need to be aware is the new variants, or we call it the 1B clade, yeah, as we found in the Congo. And as Paul, you are right, because of the high mobilization, people moving from one countries to another countries, and we know this Mpox already spreading across not only in Africa but in Europe, and even in Asia, even like Thailand, they already found the clade 1B cases that come from someone or travel from Africa. So that's why because of WHO increased the status of the Mpox to the global concern, the first thing that most of the country will take the action, of course, is having a very quite strengthening their like the airport or the entrance of the country. Yeah? So we know that this activity like screening every passenger come out from, especially in area or in the country who have reported the number of the Mpox, especially if they already have 1B clade, that we need to really have to take a precaution on this.
So Ibu Siti, since we are very concerned about this disease are spreading now, and prevention also been taken by the government. So to prevent this disease, is there any home test available for Mpox, such as blood or swab test?
Yeah, so there is no such as like what we call it home test, yeah, like COVID, yeah.
Yeah, because we learned from the past.
Yeah, because we know that even to diagnose the Mpox itself, we need to take some of charge from the. We know that because the Mpox have like a rash, painful notes, yeah. So that we need to take the charge of this note and then check to the laboratory, and we cannot have like our own test, yeah, Pak Shafira. So if we have like the symptoms such as fever, headache, and then we know there is like a rash, yeah, red rash. So I think almost everyone know. We call it, this is a pox, something like
a form of a pox.
Either,
right.
because they have like the same things, yeah.
Or we should start wearing a mask or something?
Yeah, would that help? I mean, you know.
No.
Okay. Well, I definitely really did not like the swab test for COVID. I would actually prefer a blood test as opposed to a swab test. Anyway, we do know that we refer to this virus now as Mpox, but it originally got its name from an animal, monkey pox. Is there any relation on how this virus is transmitted? Can it be transmitted from humans to animals and vice versa?
yeah, the first we found the cases. It's transmit from the monkey in the Africa area. I think it was in 1950, but currently it's already transmit to human. So that's why the WHO mentioned we did not call it monkeypox again, but we call it only Mpox.
Correct.
Because it's already direct transmission to person, and yeah, I would like to highlight regarding your question about wearing a mask. I think for Mpox we don't have any precaution to wearing a mask because the main transmission is from the close contact. So it's really like a close contact, such as skin to skin, like when we are touching or having sex, something like that, or mouth to mouth, or mouth to skin, and can be face to face, but it's very close face to face. And we know why the children got this Mpox, because they usually have a close contact with their parents. And then, by touching each other, skin to skin, it was the main transmission of the Mpox disease.
So wash our hands frequently, take a shower, and I think that things that can be as a prevention.
But less transmissible than what we experienced with COVID-19. So that's some good news.
All right. So, Bu Siti, Bu Siti,
yeah,
sorry.
But still precaution.
Yeah, precautions, of course. Always, yes. So WHO recommends targeted vaccines for Mpox. Could you explain more on this, and how's the drive going on in Indonesia?
In Indonesia, since we found the first cases in 2023, we already start the vaccination. But as WHO mentioned, this vaccination is not for everybody, Paul and Shafira. This vaccination, we call it post-exposure vaccination. So the vaccination is only addressed to the people who have exposed with this disease. So, because this is like a close contact because of kissing or having sex. And mostly the case is we got from the high-risk group who have high-risk sexual behavior. Yeah, they have like multi-partners. And then when someone is having Mpox and they already have like multi-partners, so we don't know whether the one who having sex with this patient will develop the disease or not. So that's why this group who have very need for the vaccination, because that's why we call it the post-exposure vaccination.
Right.
So this is not for everybody. We only aim this vaccination for the health team, yeah, and then the one who have exposure on this the disease, for example, like MSM or men sex with men, the high risk group of the population.
Gotcha. Okay, so let's just say then we do have suspicions that we may have got Mpox. We go to the doctor, we get ourselves tested. So let's say somebody does have the Mpox virus. What are the available treatments? How do we treat ourselves? I mean, I remember with COVID, we would have to kind of separate ourselves as far as possible from other people, or if we're in the same household. Is there an incubation period? Because I remember with COVID, there was an incubation period where you may not test positive yet at first, but maybe after a few days it would. Could you explain a little bit more in regards to what would happen when somebody does have the Mpox virus and what the available treatments are after that?
Yeah. I think the incubation quite long, because from the information that the incubation, it can be 1 to 30 days. Yeah.
Wow.
It really depends on the immunity of the person, because the current number in Indonesia, we have like 88 cases from 2022, and like 67% is men, and then like 60% is men with who have high risk on sexual behavior. We know like MSM, and then like 70% of them are they have immunity problem. So, and it's same things with the global pictures. So it's not only in Indonesia, the situation we found it, but the same as the global picture. So what we should do, because we learned from the Congo, now it's not only in adult, but even in the children because of their close contact and the long duration of the incubation. So once you have developed the symptoms, first, of course, like fever, headache, and myalgia, and then especially when you have a rash, a red rash as a sign of pox, we know, you have firstly thing, go to the health facility. So you will get diagnosed because we mentioned that how to diagnose is we cannot do by ourselves. We need to take some of the specimens and then sending to the laboratory. It will take like 2 weeks to really find the Mpox or not. And the second one, we don't have currently special antivirus for the Mpox. So we only give a general antivirus, and then we treat any symptoms. For example, if you have high fever, we will have like anti-fever, and then if you have like a headache, of course you will have like headache drugs.
So treating the symptoms,
thing, yeah, only treating the symptoms, because mostly like they will recover in 2 or 4 weeks. And the third things, yeah, like in COVID, you do the isolation, but isolation in Mpox is not like a COVID. You do isolation because of you will spread this disease to the other person because of the close contact. Yeah, as long as you don't change any like your towel, or you're not using the same any wear clothes or something, I think we can prevent it. But yeah, try to avoid direct contact like skin to skin.
Okay. So, Bu Siti, you might realize that people now are traveling, especially we are welcoming the end of the year very, very soon. And do you have any tips, particularly for those who are planning to travel, especially to Africa?
Yeah, of course, currently there is no recommendation to have the vaccination before you are traveling, for Mpox disease. So what we should do is, of course, like you maintain high personal hygiene. Shafira already mentioned, wash your hands, because Mpox can be transmitted through other things that already contaminated, such as like a rail of the stairs, or even like a handle of the door or something. Because of once the area already contaminated with the virus, you might get the disease. So maintenance your personal hygiene is a must that you have to do if you are traveling. And then of course, if you have like a pox patient, don't get close to them.
Yeah, that's the thing.
Don't visit any patient
right.
During your visit to other country. And of course, take precaution when you have fever or even you have rash. You go to the health facility, and then of course you don't go anywhere. It's better you stay at home and then try to isolate yourself.
Okay, I think most of these things are common sense, so to speak. So finally, I guess if we zoom out, big picture, Bu Siti, do you think our national healthcare system right now is adequately prepared to handle any potential Mpox outbreak if there happens to be one?
Yeah, I think we are ready to handle this Mpox. Yeah, first because we know that we already have quite a number of the laboratories can exam or can be test for the Mpox. And the second one, we already have facilities who ready in terms of the drugs, although there is no special drug for Mpox itself. But from the 88 cases that we found, we don't have any death cases. So it's they already cure, and then they don't have any severe diseases. And then we already have the vaccination. We already took the preventive action by vaccinate the health team, and of course some group who already high risk for this disease. So we have like 4,000 vaccine last year, and then we already distribute and provide this vaccine to the MSM group for the numbers that we know as a close contact of the 88 cases. And the other things we will help as Indonesia Africa Forum in the next month, and we already have SOP in airport when we are receiving this all Asia Africa delegation that will be held in Bali.
Okay, that's great. So thank you so much, Ibu Siti, for your time. We know that you're a busy person, so we'll let you get back to your morning, but thank you for taking the time out and sharing this information in regards to the Mpox virus. Have yourself a wonderful day.
Okay, thank you, Shafira.
That was Ibu Siti Nadia Tarmizi, the head of the Indonesian Health Ministry's Communication and Public Service Department. We hope that that discussion has helped to enlighten you a little bit more about the Mpox situation here in Indonesia as well as around the world. In the meantime, speaking of Southeast Asia, we'll take a short break. When we return, we'll have the latest updates from Southeast Asia, including this morning's headlines. Stay tuned.